the delay with the participants, and I will start now. Hello to everyone, and welcome to this webinar on migrant or refugee health in Agenda for Africa, organized by the M8 Alliance together with the Lancet Migration Commission and Makerere University. My name is Luciano Saso, and I'm Vice Rector of Sapienza University of Rome and member of the Executive Committee of the M8 Alliance. Migrant or refugee health has been an important topic for the World Health Summit since 2016. And many sessions were organized at the annual event in Berlin, at regional meetings, and at more specific expert meetings. In this very difficult and tragic COVID period, we organize monthly webinars. More information and the link for free registration is available at the World Health Summit page dedicated to migrant refugee health. For this meeting today, I would like to thank very much Davide Mosca, former Director of Migration Health at the International Organization for Migration, and his team, Jocelyn Clark and her team at Lancet Migration, and Makerere University, host of this very important World Health Summit, the first one in Africa, and especially, in this case, Chelsea Bingira and Bruce Kiranga. I would like now to give the screen to Jocelyn Clark, Executive Director of the Lancet, the world's leading medical journal. For the sake of time, I will not go through the details of her professional biography, which is really amazing, but I would like just to mention that she is a passionate advocate for global health, the social and political context of health, and gender equity. I would like to thank all participants for being online with us and wish to everyone a very pleasant and fruitful meeting. Thank you again, and Jocelyn, please, you have the screen.
Thank you very much, Luciano, and to everyone who's joined us today. We're so delighted that you've come together with us in this really wonderful event. I'm absolutely delighted to chair this panel of our esteemed expert colleagues, and I want to welcome and thank all the many distinguished guests that have joined us here today. I'm really very pleased as well to represent the Lancet, which is a medical journal, and the Lancet Migration, which is a project of ours that is a global collaboration of researchers, implementers, policymakers, and advocates who are working together in a large network across the world to advance migration and health. We are building on the recommendations of the UCL Lancet Commission on Migration and Health, which we published in December of 2018. And those recommendations really call for us to bring a particular approach to the work that we're doing together, one that's explicitly research-driven, evidence-based, context-specific, and regionally led. And it's in that spirit that we come together today. I really want to express my gratitude to the M8 Alliance, our partners in this event today, along with our other partners, Makerere University. And it's really their responsibility that they brought us all together, joining in a shared dialogue today. Thank you also to our colleagues at the World Health Summit, who have for so long made room on their incredible agendas for migration and health, with this year being no exception. So a shared dialogue, that's why we're all here together, and that's our objective for today's event. We want to raise and foster interest in the pressing issues of migration and health, no more urgent than during the times of COVID pandemic, which have revealed so many inequities in our societies. We want today to be an opportunity for our colleagues to share regional and local perspectives, and also very much to strengthen our collective aspirations for partnership, for solidarity in the space of migration and health, and really get a sense from our incredible panelists and the participants who have joined today on their priorities, their interests in seeing an African migration and health agenda. I can say from the point of view that it is our hope and our commitment to you that we will support your work, that we will engage with you on any level possible to help profile, bring visibility to, and help deliver a policy agenda for African migration and health, but also very much to ensure the health, the well-being, the livelihoods, and the rights of migrants and refugees across the continent in all its diversity, and of course, worldwide. So thank you to everyone who's joined us. I have no doubt this will be a stimulating and energizing event, and it will forge the bonds that we already have even stronger. So let's get going toward our panel. So just to let you know, I'm going to introduce each of our expert panelists in turn. They will then each give a few minutes of remarks. At the end of the entire panel, we will have a period of time for a question and answer period. So I would like to ask all colleagues and participants in the call to please put your questions in the chat function of Zoom today. You can do that throughout the session, and we'll make sure that those are cataloged and I can put the questions to our panelists. Following the Q&A period, our colleague, Dr. Davida Mosca, will provide a reflection on our discussions today and what might a future agenda look like. So with many thanks to Davida in advance. So I wish everyone a very best wishes for a great event, and thank you again for coming. And without further ado, I'd like to please introduce our first panelist, Mr. Jeffrey Wagula Kundu, who's the Migration Coordinator for the African Union Commission.
Sorry, Jocelyn, I think Geoffrey is not yet in. I propose we pass to Fiona Brack, then Geoffrey will speak as soon as he joins.
Okay, thank you, David. I thought we had all our panelists. Wonderful. Well, Dr. Fiona Braca, who's from the WHO Regional Office for Africa, the Emergency Operations Manager. I wonder, Dr. Braca, if we could hand over to you just now. Welcome.
Thank you. And it is our pleasure to be part of this important discussion. I am representing the WHO African Regional Office for Africa. And thank you to the organizers of this platform for inviting us to join you this evening. The WHO Director General, Dr. Tedros, at the UN General Assembly in 2017 said, and I quote, "If we are to remain true to the principles of Sustainable Development Goals and leave no one behind, we must do a better job in getting health services to refugees and to migrants." And when we say health for all, we mean all, including migrants and refugees, regardless of their status, end of quote. And the statistics speak for themselves. It's estimated that we have, there are 22 million migrants in the WHO African region. And during 2000 to 2017, the total number of international migrants rose from 173 million to 258 million, an increase of 49%. With the rapid growth in population, Africa's urban population is expected to, projected to reach 60% of the total population by 2050. And 40% of the urban growth is attributed to migration. So we do have a challenge at hand, and collectively, we are happy that this is being raised for discussion in platforms such as these. In the health field, it's crucial that the needs of migrants and refugees be met within the framework of international agreements which countries have adopted, recognizing the right to health of all individuals and the centrality of this principle in the design and implementation of policies and programs at global, regional, and national levels. We are further guided at WHO by the principles of non-discrimination and equitable access to health services. Many refugees and migrants lack access to healthcare services, including health promotion, treatment, care, mental health services, in particular for post-traumatic disorders, which affect many refugees and migrants. And the migration and displacement process may lead to food insecurity and nutrition problems, which further exacerbate the risk of disease. The 72nd World Health Assembly in April 2019 endorsed a global action plan 2019-2023 on promoting the health of refugees and migrants. This is also enclosed and aligned within the WHO General Program of Work 2019-2023. And the goal of this action plan is to assert health as an essential component of refugee assistance and good migration governance. And it acknowledges the entitlement and access to health services by refugees and migrants, varying from country to country, but also determined by national law. In Africa, we are guided at the WHO by this global action plan. It's enshrined around 6 key priority areas, which guide our work in ensuring that there is access for health through a mix of short-term and long-term public health interventions, continuity and quality of services, mainstreaming of refugee and migrant health into the agenda at global, regional, and country level to ensure that it is sensitive to migrants and refugees, and that the policies and the legal framework and social protection aspects are catered for. The priorities in this action plan also look at social determinants of health and acceleration of progress towards the SDGs, including universal health coverage, and not forgetting health monitoring and health information systems, because we need data to guide us on our interventions, and also provision of evidence-based health communication and other health-related information. So we are excited about the prospects of platforms like this. As WHO, we continue to advocate that these issues are included in the planning at country level, and that capacity is built to address these, to ensure that health policies and strategies are aligned, and that the health response addresses the unique needs of migrants and refugees. So thank you very much, and we are happy to be here once again. Over to you.
Thank you very much, Dr. Braca, for sharing with us the priorities and the development of the Global Action Plan. I have no doubt we'll have a chance to speak about that in our Q&A. And I wonder, please, if our colleague, Mr. Jeffrey Kundu, is joined, or if not, if we might call upon instead Mr. Mohammed Abdikar, if he might step in whilst we wait for Jeffrey to join. Are you happy to do that, Mohammed?
Sure, no problem. Happy to do that.
Thank you. So welcome. Our colleague, Mr. Mohammed Abdikar, is from IOM, the International Organization for Migration. He's the regional officer for Eastern Africa and the Horn. Welcome.
Oops, sorry, thank you very much. Can you hear me?
Yes, we can.
Thank you very much. It's very good to have this discussion, very opportune during a pandemic to talk about the issues of migrants and refugees. But also I'm glad to see my friend David Mosca by video. Long time, David. Thank you very much for the invitation. I'm going to focus on 3 main points. First, the fact that health of migrants, it is not simply a medical issue, but it's also a social and economic issue, and mainly about how we manage the conditions of migration. The second point is going to be that we need to identify key migration dynamics combined with relevant health challenges. One terminology, several realities, with different conditions that combine with different health outcomes and risks. And third, that we now have an unprecedented opportunity to advance the health aspects within migration governance and the partnership through Global Compact for Migration that was adopted by our member states and also through the UN network of migration that we are forming in every single country in the globe. I'll start the first one, the importance to understand that the health of migrants is not just a medical issue, but it's a social and economic issue. And mainly it is about how we manage the conditions of migration. Promoting the health of migrants and migration affected population is not only about protecting them, but it's also a critical enabler for safe, orderly, and humane migration, which is essential to sustain the economic development and benefits of migration for both sending and receiving countries. During COVID-19, we've seen that migration and human mobility has been undermined during the response. For example, in Eastern Horn of Africa, as an example, it resulted in thousands of returnees and migrants stranded in the region, left out of preparedness and response plans, and without any support except from international humanitarian and development partners. In Kenya, we were able to second close to 300 of our health workers to support the Kenyan government for the quarantine facilities here in Nairobi. We went ahead and also trying to provide COVID-19 tests for truck drivers simply because they were stuck in the middle and we had kilometers and kilometers of trucks stuck at the border between Kenya and Uganda, just to give you an example. To address health in the context of migration, we should not only respond with an ad hoc or emergency interventions, but by better managing migration and by better integrating and including migrants into our societies. In this sense, integration and access to rights is a critical social determinant of health for the migrants themselves. I want to reference very quickly the IOM strategy, where health is unified into an integrated approach through the 3 pillars on resilience, mobility, and governance, because different migration realities need tailored public health actions, which bring to my second point, which is migration, one terminology, several realities with different conditions that combine with different health outcomes and risks and the risks that come with it. Importance to identify key migratory dynamics combined with relevant specific health challenges that the migrants are going to face. Apart from the variation of migrant subpopulations, including age and gender, as well as their personal background, medical conditions, and biology, the impact of migration on health status might vary according to the health outcomes is investigated. The type of migration, the length and mode of travel, and we've seen migrants going into desperate conditions, particularly in this region, trying either to reach Europe or trying to reach Southern Africa or trying to reach the Gulf Arab states. For example, displaced persons and migrants in irregular situations are exposed to more vulnerabilities than those in regular situations. For example, along the migratory route in Eastern Horn of Africa region, we can speak of 4 major routes. The eastern route to Kingdom of Saudi Arabia, where we have close to 150,000 migrants, majority from the Horn of Africa, trying to reach Saudi Arabia through the Gulf of Aden. Then we have the internal Eastern Horn of Africa route, which is more of movements within the region itself. Then we have the southern route, which is mostly trying to reach Southern Africa, South Africa particularly. And then we have the one that most of the people know about because it's always on CNN and BBC, and that is the northern route towards Libya and Europe. IOM has found through our network of migrant response centers across the Horn of Africa that migrants en route might experience huge dehydration, skin problems, infectious diseases, violence-related health complications, including injuries, psychosocial distress, rape, gender-based violence that continue all the time. Just this year alone, in Djibouti, we've seen bodies of migrants floating at the shores of Obok, close to 80 to 100 migrants that we've seen. Numbers might be much more than that. Next, under bilateral labor migration agreements, which it's something we want to see member states look into, which regulate their stay and their rights. And I want to mention here that we formed what we call the Regional Ministerial Forum for Migration for Eastern Horn of Africa, where we brought together labor ministers of the region to look at the process of migration. What is happening to your citizens? And how can you help them when they arrive in countries, particularly in the Gulf countries, where we see most of these problems happening and those caught in conflict situations like those in Yemen itself. It's critical to cover occupational health, not only as pre-departure medical screening, but through the whole stay in hosting countries to safeguard the health of African migrants, particularly those sent to the Gulf Cooperation Council countries. Meanwhile, migrants in long-term and stable situations might encounter different health needs, such as maternal and child care. As we report in our primary healthcare clinic in Isli, in Nairobi, where you have majority of the migrants, Somalis, Ethiopians, Eritreans, you'll find all of them in a sub-county in Nairobi in Isli. They at times also have increased trends of non-communicable diseases, including hypertension, diabetes, due to challenges of adaptation or related to migrants' attitudes, lifestyles, values, cultures, beliefs, and behaviors as they adapt to their new environment, as reported in many of high-income countries. When you look at this, it is important to take a comprehensive and long-term approach to migration as a central aspect of part of the regional integration and development ambitions of the regional and continental, and indeed of the 2030 Agenda for Sustainable Development and the African Union 2063 Agenda itself. We can only change the current narrative from opportunity to strengthen the health system for all through a clear long-term vision, including migrants and the mobile populations themselves. Still, health aspects have often remained marginal in migration governance. This brings me to my third point and last point, the importance of advancing health within migration governance. And we have an unprecedented opportunity for advancing this health aspect within migration governance and partnership through the adopted Global Compact for Migration, through the UN Network for Migration, through what we call the National Coordination Mechanism of Migration that we are setting up with member states, not just in this region, but in the whole of Africa. There is a momentum with new conditions to understand and better address health aspects of migration in a more sustainable and visionary manner, and to build a health focus within ongoing migration governance process. We have to bring the topic ourselves to the table. While health is mainstreamed across the Global Compact for Migration, the compact also includes a commitment under Objective 15 on access to services. The Global Compact makes it clear that this is about human rights and includes a commitment to strengthen migrant inclusive service delivery, as also stated by the two World Health Assembly resolutions. Jointly, the WHO and ILO, IOM is currently leading the continental consultations on thematic area 3, which includes Objective 15 related to health in the preparations for the African regional review of the Global Compact scheduled for July in Morocco. It might be postponed to August. Let's hope the pandemic will not make this be postponed much further. This is a stakeholders consultations scheduled to day after tomorrow on 1st July. It represents opportunity for member states and stakeholders in Africa to provide updates on the health of migrants, to influence the global discussion in Morocco. And I will encourage all of you listeners and panelists to also engage, and we can be able to send you the details for that as well. Expanding inclusive service delivery cannot be done by any single actor in isolation. IOM is therefore very proud to have been supporting member states throughout COVID pandemic to expand the reach to migrants. And our partnership, particularly WHO and academia, is essential for evidence-based policy and programming. Currently, for example, we're working closely with the Makerere University here in Uganda and also at the Khan University in Nairobi. We also need to generate more experts and create a robust pool of African expertise on migration health, including through the introduction of this new discipline in medical and nursing schools in Africa, while also sensitizing migration experts on the health aspects of human mobility. We are therefore very delighted to support, in collaboration with the Austrian Center of Migration Health, the first online course on health and migration, postgraduate course at the Makerere University. Makerere next, who will be the next sponsor to provide more details, I assume. Engaging in joint research and peer-reviewed articles that we're now publishing with Aga Khan University, which is supported by a recent memorandum of understanding, and also collaboration with Columbia University to disseminate the Africa experience into global discussion and think tank. Let me conclude. To address the health challenges in migration, it requires changes in the health system to adopt the fact that people are continuously moving within countries and across borders. This scenario requires a new thinking of our African public health, and it will be critical to realize the promise of regional integration. If we fail to address the human mobility in public health decisions, we will not only fail to protect the human rights, but also fail to strengthen the whole health system, leaving pockets of population unattended and diseases spreading underground. Amongst the most important messages I would like to address today is therefore the urgent need to increase advocacy to fast-track the progressive inclusion of migrants into universal health coverage and all other national health plans, including national disease control programs such as tuberculosis, HIV, and malaria control programs, and the current national deployment plans for COVID-19, in which eligibility of migrants for vaccines is still very, very unclear. With that, Madam Moderator, thank you very much.
Thank you very much, Mr. Abdikar. We really appreciate hearing the IOM approach and the detail with which you've described the situation in that part of the continent. Let's move on quickly. We have our colleague now, Mr. Jeffrey Kundu, joining us, and a very warm welcome to him with apologies that you had difficulty joining. Mr. Kundu is the migration coordinator at the African Union Commission. The floor is yours.
Thank you so much, Jocelyn. Can you guys hear me?
Yes, we can hear you well.
Okay, thank you so much. And again, apologies for that technical hitch. And may I take this opportunity to thank the organizers of this meeting for finding it fit to include and invite African Union Commission into this meeting. I think much has been said by my previous colleagues. I'll just add from the AU perspective what we are doing in terms of migration and the health agenda. I did do my small talking notes, not necessarily presentation, but just something to guide into. I don't know if you want me to use it from this end or you're going to display. Jocelyn, I seek your guidance.
Yeah, I think Rosie will do it for you,
Okay.
Jeffrey. Okay.
Go ahead.
Yeah.
Go ahead. Thanks.
Thank you.
Thank you. I have around 5 or 6 areas of discussion that I would want to take through you briefly on what we are doing. One thing that has been asked to just to give an overview of migration and displacement situation in Africa. I'll also try to look at the migrant and displaced persons, health concerns and issues. Then I'll also take advantage of the pandemic and other health emergency issues and probably try to dissect what they're going through, and finally try to provide some policy prescriptions of what we, from the African Union perspective, we are trying to put in place, and hopefully we will partner and work together to see that this is achieved. The migration and displacement regimes, by now, you should know that they're two different. I've spent a lot of years handling the asylum regime. That's the forced displacement aspect. But currently I'm working on the migration, and we tend to look at it into 2 ways, whether forced migration or voluntary migration. So from the African Union perspective, we promote as much as possible safe, regular, and orderly migration through labor migration within the continent and of course out of the continent. But something interesting that I would want to share with you colleagues and distinguished delegates is that from research that has been undertaken, 80% of migration occurs within the continent. So much effort and the narrative we hear that looks like there's a scenario that most Africans actually travel out of the country may not necessarily be true. This kind of migration, again, it can be either forced displacement within the asylum and refugees. It could be through IDPs. It could be normal migrants moving to look for work, for education, and any other reasons, and so on. And depending on the categories of migrants or displaced persons, the protection needs, particularly the health needs, may vary from one particular group to the other. And of course, if you look at the trend on how migration and displacement situation occurs in Africa, it depends per region. Or one region may have more forced displacement. For example, the Horn of Africa. If you look at the Horn of Africa, we have more of forced displacement, particularly refugees and asylum, because of the root causes and the issues that surround the Horn of Africa, while other areas can either be receiving countries, like the Southern Africa, specifically South Africa, receives more labor migrants and circular movement of refugees and asylum seekers, and so on and so forth. Again, we did commission a study this early last year, late last year and this year, to look at migrant and health situation. And I must admit in this session that I'll be more biased in terms of migrants regime than asylum regime. Though I'll be happy to take a lot of any questions within the asylum regime, because I spent considerable time working within the asylum regime, not only in my country, Kenya, but in other parts of the continent. There are 5 to 6 things that came out from the study. One, there is within the migration and displaced people health situation, the first issue that came out is the lack of systematic data and statistics on migrant and displaced people's health system. We do not have any data. And if you do, then it's not necessarily segregated to fit specific aspect that can inform policy development or implementation. So to us, that is a gap that we're working on to see how best we can address it. 2 is, of course, the lack of challenges in terms of accessibility of health system by migrants. If you look, for example, the asylum regimes and where most of the asylum seekers and refugees are placed, usually they are in those remote areas. Camps, refugee camps are in those remote areas where there are no health systems and health facilities that can serve not only the residents or the host community, but also the migrants themselves or refugees. Another area that we found out from our studies, the weak health systems, including few medical, of course, I've mentioned that, and something else is about the barriers in terms of accessing these medical health systems. It could be language, it could be the level of vulnerability, and so forth and so on. Documentation system, most migrants, of course, whether forced displaced people or trafficked people, may not necessarily have the necessary documents. So lack of it actually denies them from getting the kind of necessary medical support they may need. One other aspect that we found out from our studies, the increasing securitization of migrant and asylum regimes in the continent. And this is happening everywhere in most countries in the world. To us, it's a concern, and it calls to us as a way forward to see how to develop as much as possible protection-related advocacy strategies to ensure that migrants and asylum seekers get the necessary health support they require within member states' jurisdiction. Last but not least is the aspect of policy coherence. There's a big gap in terms of policy coherence. We saw it during Ebola pandemic. We see it in different health emergencies, including the COVID-19 and any other things. You see a region, for example, have different health protocols to different migrants, depending on nationalities and where they are coming from. So to us, that's an issue that we need to put our heads together and see how much we can address it. And last but not least, of course, my colleague Kadri mentioned is the lack of targeted healthcare needs and intervention framework. If you allow me to conclude what we are doing, the second last slide, because I think I've mentioned most of those things, is what exactly are we doing as African Union to address those issues? Second last slide, the next slide, please. One is we are now working within the Commission to develop a migration and health policy document. That to us is a concern, and we want to ensure that there is an aspect of policy coherence within the continent on how to support migrants' health, not only during emergencies, but during normal health situations. Two, of course, is the capacity building of national and regional institutions that offer migration and health and try as much as possible to support member states and advocate in terms of mainstreaming migration health within the national policy framework and regional policy framework as well. And lastly, Madam Moderator, is an aspect of data and research. By now, colleagues, you're aware, and distinguished delegates, that the African Union is in the advanced stage of establishing migration data centers in Morocco and in Mali. Together, the Continental Operations Center in Khartoum, Sudan. Part of the work of those centers is to churn out this necessary information, data, and statistics that we may require in terms of supporting policy development and implementation or within the area of migration and health. In my conclusion, Madam Moderator, is that to us, we can take advantage of the pandemic as it is to look forward on how best do we address issues of migration and health, not only during the pandemic, but beyond. Two, we also need to work together to see how do we advocate for member states and regional entities to mainstream migration and health in their national, regional, and policy frameworks. I thank you so much, Madam Jocelyn. Thank you so much.
Thank you, and we thank you so much. I mean, such a rich and detailed presentation, like the colleagues who went before you. I know we're going to have many questions for you. Some of the research and data and conclusions you've drawn are incredibly important and interesting. But in the interest of time, we'll move on very quickly to our next panelist, and it's with a big welcome. I ask that Dr. Florine Clomaga please join. She is the Deputy Director for the Africa region at IFRC, the International Federation Red Cross and Red Crescent. Welcome, Florine.
Good afternoon, Madam Moderator, distinguished ladies and gentlemen. With great satisfaction, I address this August gathering to speak about issues of migration and health from the perspective of IFRC. The IFRC is committed to ensuring the safety and protection of migrations, regardless of the situation, location, or status. As part of this ambition, IFRC strives to provide access, presence, auxiliary role, and important place on the most vulnerable. It's uniquely positioned to prevent and alleviate suffering through humanitarian action, protect all migrants' rights and dignity, and assist migrants in integrating into host country societies. In addition, the IFRC helps migrants at various stages of their journey, and this assistance is linked to advocacy efforts aimed at reducing migrants' vulnerability and increasing their resilience. The IFRC has found through experience and research that inadequate access to essential services, including healthcare, exacerbate the risk and vulnerability faced by migrant populations. COVID-19 has highlighted and in many cases amplified the severity and impact of such access issues, while underscoring the critical nature of ensuring access to primary healthcare for all, regardless of circumstances or statute. The IFRC Migration Lab's subsequent report, Lockdown and Left Out, built on previous experiences and research to examine additional barriers to essential services faced by migrants in 8 countries worldwide, including Ethiopia and Sudan in the Africa region. The report placed a premium on the inclusion of migrants in national COVID-19 response plan and vaccination policy. As with previous finding, migrants continue to face significant barrier to health and essential services access. While some government provided much needed assistance to migrants, such as relaxed visa and residency requirement and procedure, as well as the inclusion of migrants in COVID-19 testing and treatment, many continue to face barriers. Exclusion from services due to legal status, the lack of information, cultural and linguistic divide, and financial constraint all contributed to the decreased access to essential services. In Africa, the Red Cross national societies continue to provide health assistance to vulnerable people on the move through information dissemination, including on COVID-19, safe referral to hospital and specialized services by supporting and resourcing health centers along migrant routes, and in some cases by deploying mobile clinics in undeserved areas. National societies often seek to reinforce and promote local structure when they provide health and WASH assistance to displaced situations, as was the case during the recent Tigray crisis. In addition, as COVID-19 vaccine become available, numerous national society promote vaccine rollout campaign and advocate for the inclusion of refugees, internally displaced, and mixed migrants in search programs. In the future, the IFRC and National Society will look for novel and innovative ways to respond to migrant needs, including the use of digital identities in healthcare and the implementation of a roots-based approach to migration, leveraging the Red Cross movement global yet community-based network. Migrant health, which include refugees, internally displaced persons, and mixed migrant population, is about ensuring the most vulnerable among us have humanity and dignity. Assuring this population have access to essential health services is also a matter of public health. Although this has been true, the current pandemic has highlighted it even more. The IFRC aspires to play a critical role in protecting and assisting people on the move and the community they find themselves in. With this experience and knowledge, the IFRC and its vast network of Red Cross National Society aspire to take a route-based approach to migration. Red Cross Red Crescents ensure that those in need have access to essential services, assistance, and protection, while assisting countries and government in meeting their health commitment and the regional and international framework, including the Global Compact for Health. Thank you very much, everyone, for listening to me.
Thank you very much, Florine. We really appreciated hearing about the work of IFRC and in particular this roots-based approach, but also the ways in which you highlighted the particular vulnerabilities of some types of migrants over others, and that's very appreciated and very much complements other panelists' discussions. So thank you very much. I'm sure we'll come back to you during the Q&A. I'd like to ask next to join our panelist, Doris Mapumu, who is the Director and African Union Representative at Save the Children. Welcome, Doris. Hi, Doris. I think you're just on mute.
Oh, thank you. Thank you, Madam
Welcome.
Moderator. I'm sorry.
Over to
Thank you very much. Thank you. I hope you can hear me well now. My internet connection is not very stable, but
Okay.
I hope it will be okay. So thank you very much again to the organizers for inviting Save the Children to participate in this very important dialogue. I've been asked to reflect on the health challenges faced by millions of African children on the move within and outside the continent. To start my presentation, I would like to actually start with a definition of the terminology children on the move. What does it mean? Children on the move is not meant as a new category of children. It is an umbrella definition that brings together the multitude of categories in which children who move have been often unhelpfully divided. This definition therefore includes children who have been trafficked, children who migrate for, to pursue better life opportunities, look for work or education, or even escape exploitative or abusive situation at home. The terminology also applies to children displaced by conflict and natural disasters, as well as children who live and work in the streets. So it is, I have to say that it is fortunate that now children movement is gaining increased recognition as part of larger migration flaws, and there is growing attention, particularly from, of course, child rights organization, to the specific perspective, interest, and vulnerabilities of children who are on the move and on the impact of mobility on children. So that's, it's a plus. And I think also the invitation to participate in this dialogue is a testimony to that. We just heard from the colleague from the AU, and our office, I work for the AU Liaison Office, the Save the Children AU Liaison Office to the AU. And so what I will talk about is also linked to the work we do with the African Union Commission, as well as the work we do in the 26 countries where we're present in Africa. So we know that we've heard that the policy framework is quite strong, and AU member states have taken really strong policies to protect the human rights of migrants, including the right to health, and it has been emphasized in several continental policies and action frameworks, which prohibits discrimination and stipulates that every individual has the right to enjoy the best attainable state of physical and mental health. Member states, AU member states, have also called on host countries, on countries to ensure that, especially host countries, and to ensure that migrants, whether forced or voluntary, are given the same treatment as citizens with respect to access to social services such as healthcare. In particular, the African Charter on the Rights and Welfare of the Child, which is now ratified by 50 out of the 55 AU member states, under its Article 14, provides that every child shall have the right to enjoy the best attainable state of physical, mental, and spiritual health. The article also places an obligation on states to pursue full implementation of the right. Therefore, based on Article 24 of the Convention on the Rights of the Child and Article 14 of the African Charter on the Rights and Welfare of the Child, governments have an obligation to recognize child migrants' rights to enjoyment of the highest attainable standard of health, and to strive to ensure that children migrants are not deprived of their right to access health services, regardless of their migration status. In addition, the African Committee of Experts on the Rights and Welfare of the Child conducted a study on children on the move, following concerns around the growing number of children on the move within the continent. Just as a reminder, out of the 29 million displaced people in Africa, the majority, well, half of them are children, close to half of them are children. The committee recommended in the study that they conducted that health care services of good quality should be available, accessible, and acceptable to child migrants. Healthcare services for child migrants may range from preventive or curative and mental, physical, or psychological care. State must also ensure that healthcare for children on the move is not undermined by discrimination and negative gender biases. Also, children must be afforded age-appropriate sexual and reproductive health information services. So as I said, the policy framework, policy and action framework is quite strong. However, we note that there is a discrepancy, as in many areas, between the reality, that is the promises and the reality. So now let me touch a little bit specifically on the challenges now that I've framed the legal policies that we have at the AU level. So despite a strong policy framework, access to healthcare still represents a challenge among local population in Africa, where for the majority, universal health coverage remains a distant goal and healthcare services are paid out of pocket. So you can imagine the situation for children on the move, especially the children who move without their parents or their guardian. So in light of this, maintaining good health among children on the move is a challenge, not only because of the health risk commonly associated with the movement of people, but also because of the economic hardship that they face and undesirable condition in which they live. It is therefore critical for children on the move to access the host or transit country local primary healthcare services at minimum. Studies have highlighted several factors that adversely influence access to healthcare by children on the move. Recently, Save the Children has conducted a research in the Eastern Route, including over 400 children in Ethiopia and youth, including IDPs, returnees, refugees from Eritrea and Somalia. And the research revealed that limited access was often due to financial constraints and distance to nearest healthcare services. This is, it means that although we know the challenges, we still have some ways to go in terms of addressing those challenges. One interesting observation is that children on the move from subsamples that involved official registration, so refugees and returnees have better access to health than IDPs, which were interviewed outside their home communities in cities. Close to half the IDPs reported not having access to healthcare services. Sadly, the data is not in depth enough to allow for a better understanding of the cause of this difference. It could be better service provision or possible better referrals, or even better awareness and access to information. And the other element, of course, that we also know, it's documentation. Documentation has come up as a key barrier to accessing health services in work in Southern Africa. Even though policies do grant access, this access is often linked to the documentation that are required and that are difficult for irregular migrant children and youth to meet. The third element is the attitude towards migrants, children migrants by health workers, hostility towards those in need, especially needs around sexual and reproductive health and rights, as well as mental health and psychosocial support, often discourage children and adolescents on the move to seek those services. One last point in relation to the challenges, the Girls on the Move in Southern Africa, for example, study also highlighted issues around maternal and pre as well as postnatal health services, with harrowing stories of girls being harassed and neglected by hospital staff.
Doris, of course, I have to ask.
Yes, I'm concluding.
Thank you.
It's always difficult to gauge from these studies which of all have a geographically narrow focus, what the most pressing issues are. However, it is important to recognize the specificities of barriers to accessing services. The group of children on the move is very diverse, with different statuses shaping the lived experience of children quite dramatically. Identifying the most vulnerable, those most excluded, is therefore very context specific, requiring strong needs assessment that are very aware of the migration context. In the wider literature on children on the move, again, this is work on their vulnerability as migrants rather than healthcare specifically. I believe that recommendations often specifically speak to the need to provide documentation, ensure policies are inclusive, and services providers are capacitated on the right of children on the move. So I will stop there and we'll speak to other elements of the presentation later. Thank you.
Thank you. Thank you very much. A very, very enriching and powerful set of points about the right of the child, which complement our session so well. So thank you very much. And finally, I'd like to invite our final two speakers who will speak together. They are Dr. Kalyango Ronald Seba from Makerere University and Dr. Ursula Trummer from the Center for Health and Migration. Welcome both to close our panel before we move on to the Q&A.
Thank you so much, moderator. Can you have the screen share of our presentation, please?
I'm trying to do that. Give me a second.
Okay, thank you, Ursula. Today we are discussing migrant and refugee health agenda for Africa. I'm from the School of Women and Gender Studies, and I'm here representing my colleague, Professor Paul Bukuluchi, who was unable to be with us, but we are happy to be with you, and we shall do a co-presentation with Dr. Ursula from the University, from the Center for Migration in Vienna. Next slide, please. If we look at it, I want to pick up from where the IOM left off, discussing evidence policy and programming as being critical. And that fits in very well into the Pan-African Agenda for Health and Migration, where we look at developing and building a strong African academic community of researchers who cooperate in a global context and take part in a global community of health and migration experts. Over to you, Ursula.
Thank you very much, Ronald. Let me tell you how grateful and happy I am to be with you today. We heard a lot already about this African agenda for health and migration and the major topics and also the complexity of the whole issue. And it's interesting to see that putting or repositioning Africa in global knowledge production has already been a major topic, also in a Lancet viewpoint. And you see here one quote which was co-authored also by the current Vice Chancellor of the Makerere University, Professor Navangwe. So it's about the question, how can an African agenda for health and migration also develop and build on a strong African academic community of researchers? And if we look into research in African universities done by African researchers, because this is what is needed here, obviously, we did a preliminary search from Scopus, and we looked into literature on health and migration. And if you make this search, it's quite interesting to see that you find 34,059 papers on health and migration subjects. But if you then restrict your search from research in African countries, done in African countries, and done by researchers with an African affiliation, out of these 34,000, there remain 654 papers. So you can see the knowledge production in the area of health and migration subjects is still concentrated not on the African continent and not in African universities. And if you have a further look into these 654 papers, you see that also there is quite a heterogeneity between African countries concerning this knowledge production. You can see that basically half of these publications come from South Africa. South African universities and scholars working at South African universities. Well, to develop this African community of experts on health and migration, what is a key element here? And we believe that partnerships, mutual partnerships, cross-sectional partnerships are really key elements to build such an expert community. And I'm very happy that that has been addressed by all the previous speakers already. We would like to provide you with one example for that kind of partnership, which has been mentioned already by Mr. Mohamed Abdika, and that is a project that we've been starting with an Austrian-Ugandan cooperation, which is running until 2022 with the title Migration, Governance and Health in Austria and Uganda. So you see in this project, we are combining migration governance issues with health. And you see here the logos with all the wonderful partners that we have here. And having said this, I give over the floor to Ronald again.
Thank you, Ursula, for taking us through. Looking at our first online course on health and migration, it is a direct product of partnerships together with IOM and the Center for Migration Health, among others. And it's a journey that started around 2014. And to date, we have had our first online course with 17 thematic sessions, 17 facilitators from 9 countries, which also means we are able to share expertise across the globe in the trainings. And we also had around 108 applications and 46 participants from countries as diverse as Democratic Republic of Congo, Somalia, South Africa, Sudan, and others. And of these, 35 were awarded the certificates. Therefore, taking a look at this, if we look at the next slide, please. Some of the lessons we have learned is that there is a growing demand for migration health related skills. And from all the previous discussions we've had, they all point to a policy agenda, they all point to research and evidence-based research, and they also point to a need for a human resource. And that human resource is a direct consequence or a result of the university doing training, research, as well as publication. The online teaching, despite its associated challenges, can be a useful tool towards an Africa-wide capacity building plan. This lesson for us, we just bumped into it because of COVID-19. The course was supposed to be physical within the university, but because of COVID-19, we had to change our focus and look at an online course. And the online course gave us quite a number of possibilities in what can be done, such as promoting inclusion, both of students and facilitators from a wide array of locations. But what we also learned is that the online teaching requires investment in digital technologies to be able to further the human resource trainings. Lastly, but not least, one of the key lessons we learned is that strong partnerships, collaborations, and funding are critical for the success of any training program. Alluding back to the earlier mentioned article by Professor Nawangwe, repositioning Africa's global knowledge and products, partnerships and collaborations and funding are very critical if you are to promote and foster African training, especially in the area of migration and health. With those very few words, we want to say thank you. And the last slide represents all the participants we had from the migration health, as well as the facilitators. Thank you so much, and over to you, moderator.
Thank you very much, Dr. Seba and Trumer, for completing this incredible panel of experts and perspectives. So what I might ask, Ursula, if I may, ask that you stop sharing your screen, as much as we love that gorgeous photograph, and ask our distinguished panel of experts if they might turn their videos on, and then we can join together on the grid. And just while you're coming back to us, I have the pleasure of leading a short question and answer period, but I feel like it's one of those situations where we could probably talk for the rest of the afternoon or evening, depending on where you are, because you've brought to this event, you know, exceeding expectations even, of a unique set of perspectives from your variety of roles within the migration and health space, but also really reflecting, I think, to a large degree, the diversity of needs of migrants and refugees, but also the diversity of needs of the different constituents who nevertheless have a kind of shared agenda. And I think that's the challenge, if I might admit that, for bringing some of these threads together and to imagine what you know, our shared mission could be if we were to, you know, join forces in a sort of set of strengthened partnerships or networks. So that's where I'm going to start. And I might just put this question to a couple of panelists before going on to one of the questions that our audience members has posed. So if I may, Dr. Braca, Fiona, since you kicked off the panel, if I might ask you the first question, and then I'm going to ask Jeffrey Kundu, Dr. Kundu, if you don't mind, if you're still with us, also taking this question. What does a kind of shared agenda for migration and health look like to you? I mean, recognizing all the diversity of needs and perspectives that we've had shared today, is an African-wide, a continent-wide migration and health agenda possible to incorporate all that diversity? And what would you like to see in terms of a broad shared agenda of constituents coming together? So Dr. Braca, if you may. You're just on mute. Just pop yourself off mute.
Oh, sorry about that.
No, not at all.
Yes, thank you. It's an important question, and I was just pondering in my mind, listening to all the panelists, with the work that is going on with different groups, all working towards the same objective to really bring better healthcare to migrants and refugees. And the sense I'm getting out of it is that, you know, a clear policy framework that pulls all these initiatives together is important. We recognize that countries are governed by different national laws, but in my opinion, I do believe that it is possible to have this broad framework, policy framework. It starts with the policy and that pulls all these initiatives together. A policy that has the commitment of the national governments, commitment of us as the partners, the stakeholders, and takes into account the complexities that we have all talked about. I believe it is possible to answer your question, and it's one that would also need to be evidence-driven, based on information, based on data. It has come through that is one of the areas that is lacking. It's great to hear the initiatives around research and data. But I believe that this is possible, and it's a good starting point for all of us to pull our initiatives together.
Thank you very much, Dr. Braca. So Jeffrey, Mr. Kondu, I wonder if you are still with us. I mean, you have such a unique perspective and sightline because of your role at the African Union. What does it mean to you when that question is posed? I mean, how do we incorporate all the diversity of needs? Never mind the vast population across the continent in forging an African-wide migration and health agenda. Do you see that as being possible? Do you see that already as being happening? And what would you like it to look like?
Thank you so much. And I'll just build up on what my colleague Fiona has said. I think we are on the right track, and the COVID-19 situation and other health emergencies have exposed some of the gaps that within my presentation I mentioned. And there's a lot that is happening, but what needs to be done is we need to have a coordinated approach in terms of how do we work together, who needs to do what, and how do we need to do it. But from where I sit, as you rightly put, within the African Union Commission, is that we will be happy to see a harmonized policy approach within at the national and probably at the regional level in terms of migration and health. Not that we don't have policies. We have policies, guidelines provided in different, but they are basically within the migration governance. We have the African migration policy framework that guides the migration governance and talks very little about migration and health. We have the GCM, of course, that my colleague Mohammed alluded to, that speaks some aspect in terms of migration and health and assistance and so on. But we would love to see a specific and targeted migration and health policy within the national and the regional frameworks that member states can look upon in terms of a coordinate approach in not only in emergency, but in other migration and health interventions. Thirdly, I think accessibility is something that is very critical within the migration and health systems. We need to work together to support migration and health access, being accessible to everyone, a migrant, irrespective of the category of migrants. We usually say from the AU that no one loses their rights just because they are moving, whether they are children or women or any category of migrants, trafficked or labor migrants, they still need to enjoy the rights that are enshrined within the international law bodies. Lastly, but not least, of course, the issue of data and research. I look forward to see our migration operational centers that will deal with the research and data and statistics, not only work on their own, but also collaborate to what we are hearing in this meeting. I'm glad to see what University of Makerere is doing, and I would want to reach out to them so that we see how do we strengthen and collaborate in this. I would want to link up with different institutions within the continent and beyond, and see how do we work together to ensure. I see my colleague Asala here. She's working on some research. We need to reach out to everyone to see that we work as a team. And of course, lastly, there's need to strengthen national and regional institutions that deal with migration and health. They could be refugee migration agencies within national systems or regional systems, but we need to ensure relevant migration and refugee related institutions are strengthened and work together with the national health systems within their jurisdiction. I think for me, those are the takeaway that I would want to share. Thank you.
Thank you for that wonderful summary of some of the themes that came out. Now I'm going to put the research question into a cloud because I'm coming back to it because it's something that we have a particular interest in from the point of view of Lancet. But I want to go to a couple of our NGO colleagues. So that is Florine, if I may, and Doris, and ask you a question that came through from our audience in the Q&A. And the question is, perhaps I could ask you this first, Florine. In your opinion and from your work, do you think there's been a shift in how migration and health is perceived in Africa since the start of the pandemic? Has COVID kind of shifted the narrative on understanding the needs of migrants and refugees in your experience? And I'll come to you next, Doris, if I may.
Well, what we have seen at IFRC is that there is a need to be more inclusive and bring more migrants into the work that NGO are delivering for migrant refugees. So we have started what we call humanitarian service point, and where national societies provide a welcoming and safe environment for migrants. And we respond to the providing basic services. So yes, there have been a shift where our national society have decided to provide them with a safe environment where we provide them with psychosocial support, we provide with the protection, information, healthcare, and other services. So we have scaled up our response to the humanitarian needs of the migrants to make sure that they are included in our services. So from the IFRC point of view, there have been a great level of work to make sure that all the migrants, refugee, IDPs receive, the essential services as far as health, wash, protection, shelters are concerned. Yes, definitely. We have scaled up our services to include them.
Thank you. And Doris, can I put a related question to you? In terms of kind of your, let's say your donor community or those who support the work of Save the Children, and perhaps even in the broader world around media and public perceptions, do you think COVID has helped people to understand the importance of delivering health and safety for migrants and refugees from your point of view?
Thank you very much for the question. I actually would like to build on what the colleague from IFRC talked about. The reality is that borders have closed, and so there is a push and pull in terms of really guaranteeing and securing the rights that are spelled out in the policies. The policies are there, but then they are really facing a wall in terms of their implementation and ensuring that there's a freedom of movement, especially on the continent, despite the fact that we have these measures that have been put in place to protect the expansion of the pandemic. And so we have also really scaled up our advocacy to ensure that refugee children are included in responses to the pandemic, but that those policies are really implemented, and children who need to seek asylum or needs to benefit from refugee status are definitely benefit from those rights. But I would like actually to come back to the first question that you asked. I heard the colleague from the AU. Of course, there is a need to have a Pan-African policy that would go further and look at the current gaps and build on the current gaps that we have on and perhaps also focus on migration health. However, the question for me, who work with ambassadors pretty much on a daily basis, is that, is it politically realistic? How far will we be able to go in terms of moving the needle and the policy forward? So that's really a question that I'm asking, because unless we really can show that these are the gaps and this is where we will need to go, they might ask us to look at the Pan-Africa strategy on health and how it deals with displacement. So there is a need to do advocacy and to show that there is a need to have a Pan-African policy. because politically, I'm not sure that that is where the AU is. And
I think we've lost you, Doris. I'm afraid you've cut out a bit, but in any case, you've raised an incredibly important issue around the politics of migration and health and how to advance the agenda politically. One which we will note as we move forward together in what I hope is a future of collaboration among the various groups that have joined this call. But I'd like to pose my next and penultimate question to first to you, Mohammed, and then to you, Ursula and Ronald, if I may. One of the motivators for bringing together this group was from the point of view of the M8 Alliance, from Makerere University, and from Lancet Migration, is really about thinking about the ways that research can help as a tool for advocacy in this space. And so I want to put the question to you three, just in the final moments that we have together, and ask how could a research collaboration, perhaps supported and accelerated by a group like Lancet Migration, to bring us all together with a shared mission, how could using research as a tool for advocacy, how could that help the type of work that you're doing? And would you find a benefit in the prospect of such a shared approach? So to you first, Mohammed, and then Ursula, and then Ronald.
I think it's critical. It's really important to bring the research side, the policy side included. And a very good example, just following what Doris just said, when we talk about the pandemic now, we've really faced a major impediment. And it's good I have Geoffrey from African Union also here, is we faced a situation where governments just closed the borders and left their own citizens stranded in another country. And I'm not going to mention names or do a shaming list right now, but we faced a clear situation where a large number of African migrants are stuck either in a neighboring country simply because the country of origin just refused to allow them to come in, while the country that they are being hosted also is pushing IOM, saying you need to do something about this. Then we look at the health conditions of these migrants, and we realize it's really, really critical. If we give you an example, country A, where we have migrants who've arrived from Yemen, and they're very much gender-based violence. They've gone through horrible, for the women have gone through gender-based violence, horrible other conditions. And we do not have enough research. How do we deal with this kind of caseload? Then we've been asking, and I'm happy Geoffrey also is here, to bring in not just the AU, but the RECs, the regional economic blocks, to bring up this issue on moratorium to stop deportations of migrants. Because we're in the middle of a pandemic, but here we have governments still putting people, 300 people in a plane, no testing, no COVID-19 testing, no masks, put them on planes and drop them in country B. No coordination, nothing at all. So the whole moratorium that we've been asking within the UN system, that we need to ask member states, this is not the right thing to do. But we also understand what they're dealing with. So in short, I know we don't have much time. I believe, Jocelyn, that it's critical that we do more research. It's critical to look at the migrants who they're more of the unseen human beings in most of these countries. I think if you look at refugees in a refugee camp, but we have many of them in urban areas who nobody looks at them. We have migrants, most of them in irregular conditions. I think those in regular conditions are much better because they can walk into a hospital and ask for assistance. But those in irregular conditions are afraid, if I show up anywhere else, I might be deported. So more research on this is also required. I'll stop here for now. Thank you very much.
Thank you, Mohammed. Your words are very powerful and very appreciated. We are fortunate to have our rapporteur back. Our dear colleague Davide Mosca in Italy just endured a power outage, but he's back. So I will hand over to him in a moment, but I do want to give Ursula and Ronald a chance, if you will, just very, very briefly, reflect on the question about the power of research as a tool of advocacy, just so that we've had all our panelists comment during our Q&A, and then we'll kindly hand the baton over to Davida. Thank you, Ursula.
Well, I have two answers to your question. And the first answer is we need evidence-informed policy and practice development. And for this, we need to create a robust evidence base. And this is what research is for. This is what the main purpose is, to create an evidence that can help to improve policy and practice. And the second thing I would like to say, I think it's really of the essence that there builds up an African community of experts and expert researchers and policymakers, because the African views are so important and so interesting. And I have to say, me being a European, I learned such a lot of things in this cooperation with African colleagues, because I have my bias in my views, and this is of course also the basis and the foundation of my research. I have my blind spots, and I really believe in collaborating and cooperating with colleagues from Africa who can provide different views as well. And I think it's very important to develop that. Thank you.
Thank you, Ursula. I couldn't agree more that this research and policy agenda needs to be African-led, and our role, those of us sat in Europe or North America or elsewhere, is to support and amplify and offer as much resource as we can in order to advance that. Ronald, did you want to make a final comment before I hand over to our rapporteur to close the session?
Thank you so much. Very briefly, just like Ursula has said, good policy requires evidence, and evidence has to be collected by a well-trained human resource. So from the academia, we need to be able to train the human resource we need to support the research and evidence that policy requires. And to do that also requires that we get more African scholars published, sharing their ideas, sharing their findings, and then in that way we can be able to better influence policy from our own perspective, from an African angle, looking at our own problems and being able to suggest solutions that are able to work. Over to you, moderator.
Thank you very much. Well, with that, I bring the panel to a close with very many thanks to all of our esteemed colleagues and experts who participated. As I said earlier, we could speak all afternoon or evening, but we very much appreciate your attention. And I know that we're running over slightly on time, but I would very much like to hand over to our colleague, Davida Mosca, to provide some closing reflections. Thank you, Davida.
Thank you, Jocelyn, and thank you to everybody. I mean, unfortunately, I was cut off from the meeting because of electricity. You know, Italy is also experiencing challenges in technology. I appreciate all of you. First of all, you know, the World Health Summit for having given us a space. Thank you, Luciano. Thank you to all the friends, colleagues who have responded. I thought that it was important to have an African voice on migration health in this event, and all of you have demonstrated that there is so much knowledge, capacity, passion, perceived need that bring us to really try to work together more and build an agenda that is not, you know, as it has been the case, kind of driven by the European or Western perception of what migration is. And consider the fact that we are talking about, you know, as colleagues have said, 80% of the migration that involves 22 to 25 million Africans in Africa, that produce basically what was estimated in 2017, $39 billion in remittances, 39 billions. When you consider that the humanitarian aid to Africa has been 6.17 billion. So in reality, the African diaspora, the people that move from a border to another, send money back home, and
Oh, I think Davida has frozen on my screen. Is that the case for everyone else? I think.
No, Professor.
I think perhaps he's still experiencing a bit of a wobble with the electricity. But I will echo his comment that what we have here is a shared agenda, and what we've started is a dialogue. And I hope that that will continue. And you could certainly count on all of us involved with the Lancet Migration or the Lancet to be open to any partnership and continued work that you wish to do. So let's think of this as just a starting point. And I will hand over now to Luciano to close the session with a great many thanks. And also I forgot to thank our participants for their wonderful questions in the chat. Thank you, everyone.
Thank you, Jocelyn. Just a couple of words from me, because we need to close. It's a bit late, but many thanks really to the wonderful panelists for giving us, so really excellent presentations, and again for their passion and all the work they are doing that actually they presented today. Many thanks to Jocelyn, to you for chairing so well the panel, and also many thanks to Davide, because I think he's really the main person behind this webinar today, and it is a pity that he could not deliver fully his reflections. And I'm looking forward to seeing you again on the MH Alliance screen. We are continuing with webinars on migration and health, and so we will continue also in September, October, November with monthly webinars on different taking different angles. But for sure today this topic was so important, and I'm very happy that we put the accent on the migration and health in Africa. And thanks again to Makerere University for hosting this wonderful World Health Summit. Thanks again.